All right. Hello, AREAA family. All right, we are super excited. I am Crystal Ansay. I am your current AREAA National Member Services Chair for 2024. And my big job is to make sure that we get the best member benefits to you guys. So we get hit with lots of different things. And I'm sure you guys have even seen through member benefits, all the different avenues that come in our way, whether it be flowers, advertising, mail service delivery kind of situations, hotels, car rentals, right? We see it all. And as a committee, we vet everyone and we hear what they have to offer, and we make sure that this member benefit is truly beneficial for you guys, the AREAA members. And this was one we've never been approached by any type of health anything before. So when the insurance aspect was thrown our way, it was something that as a committee we were super excited about. And after diving in deep to what Clearwater has to offer and talking to some of our AREAA members who have Clearwater as their coverage, we knew that this was the right fit for AREAA. So without further ado, because you guys don't want to hear me talk about insurance because I know nothing about it. We're going to learn it
Nonsense.
all from Jack. We're going to learn it all from Jack. So I'd like to introduce Jack Hawthorne. He is the Chief Revenue Officer for Clearwater, and he's going to be talking to us about health insurance, and it's open enrollment season right now.
Mhm.
So now is the time to make this happen. So Jack, I'm going to throw it over to you. You can introduce yourself and then what Clearwater has to offer to all of our amazing AREAA members.
Absolutely. Thank you so much. I really appreciate it, Crystal. And full disclaimer up front, I am not going to go through a bunch of plan details and stuff because if I always assume I'm the guy on the other side of this call, and my eyes would glaze over and I'd probably start doing literally anything else. And so I'm going to go through the program, what AREAA has done for you guys, and like bringing this program in, how to take advantage of it. And then we'll go into some of the details, but really the call to action is going to be go to the website, and I'm going to throw that in the chat. Actually, it's areahealth.com, super complicated website, really hard to remember. And so we're going to make sure that you guys have the ability to go there. You can, when you're there, you can book a call, which is what we encourage everybody to do, right? Like we want you to go in and have that one-on-one consultation, talk to a human being. Generally, the way we say it is like, don't FISBO your healthcare, right? Like go in and actually talk to someone who knows what they're doing about this. I've spent a little over a decade in real estate before I moved into Clearwater. And during that decade, I was a real estate agent. I built and sold a team. I became general counsel for an ownership group. Ended up taking over a really big office of about 600 agents, grew it to about 1,300 agents. And I sold that whole ecosystem in March. And so now I'm full on in healthcare. But the reason I'm so passionate about what Clearwater's doing, especially what we're doing like with AREAA, is because the entire time I was in real estate, our healthcare options were terrible. They were really expensive. The coverage was terrible. My experience is generally, like I would tell people, the experience with my health insurance companies, whoever they may have been, because it changed, right, was I paid my monthly premium every month. And then I still somehow had to pay the doctor when I went. And then I still somehow owed the insurance company money, which I don't understand. And then even though I did everything they told me to do, somehow I still ended up in collections. And I was like, guys, this is stupid. Like, I don't enjoy this process at all. And so Clearwater started by saying, okay, huge companies, like we call them BUCAs, Blue Cross, United, Cigna, Aetna, they don't really care about independent business owners. They don't really care about small business. They want big W-2 groups. That makes them happy. They feel very warm and fuzzy inside knowing that's what they go after. And they just decided it was too expensive to go after 1099s and independent business owners and real estate agents. And so Clearwater was built first and foremost to empower independent business owners, entrepreneurs, real estate agents, tradesmen, people that just don't traditionally have access to W-2 benefits. And then we started there. And then we ramped it up to start working with associations like AREAA that empower entrepreneurs and independent business owners. And so that's why we have the ability to do what we do. And so what AREAA has done is they've actually pre-negotiated a discount for everyone that is part of AREAA. So if you're a member, you're actually going to get an additional 20% off of any Clearwater product. So all the stuff I talk about in this call today it's going to be an extra 20% off of that because you're a member of AREAA. And when I tell you that it was very much like some kicking and screaming and they beat us up a little bit and kind of drug us across the finish line, like we want to make sure we take care of our affiliates, but you guys are kind of mean the way we ended up, right? They wanted to make sure you guys had the best possible benefits imaginable. It was a great process that you're super empowered, because even if you have great benefits, if you don't know how to use them, it doesn't really matter. And that's one of the things that we run into. And so what you're going to see when you go to AREAA Health, which once again, I'm going to put that in the chat, so it's down there. So when you go in to AREAA Health, what you're going to see is that you have access to literally everything. Whatever plans you would normally have on the Affordable Care Act, on healthcare.gov, through Stride, through any aggregator out there, you have access to all those plans. And so if you're subsidized, so if you make less than 50, 55,000 a year, which whether even if you don't, you know realtors that do, we help them with their subsidies, right? We want to make sure that they know what their benefits are, because just because you're on a free healthcare plan doesn't mean you're on the right free healthcare plan. Like, yeah, you have free healthcare that you don't know how to use, or your deductible is $1 million, right? It's just ridiculous stuff that doesn't really matter. And so we want to make sure that you get that very consultative approach so that you have the ability to understand your coverage. So one of the things that makes a big difference is when you go to any kind of Clearwater marketplace for you guys for AREAA Health, you're going to be able to see all the different plans, shop those plans, look at what options are best for you. We're going to take you through what feels like a quiz, right? It takes about 2 minutes. Tell us about yourself. What do you have now? What do you care about? What do you not care about? Are you married? Do you have kids? Like, what's going on? And then based on that, I say, look, based on what you told us, this is what makes sense for you. We recommend you either enroll on your own if you choose to. About 30% of people do. And then the other 70% will actually book a consultation and have a one-on-one conversation, what is essentially an HR rep to help you. So when I say that our salespeople would be the worst salespeople in the world if they were actually salespeople, I am not being dramatic. They are not commission-based. They're all W-2. It doesn't matter if you spend $2,000 a month or $180 a month, they get paid exactly the same. And so what they want to make sure is that they truly walk you through your options. They do a needs analysis, figure out who you and your family are as people, and then advise you on the best thing for you. And so there's no commission breath on it. There's no like, oh, I want to get them to get this supplement. I want to get it. It literally doesn't matter. They just want to make sure they get you the right thing. And so use that resource. Like I tell people, use and abuse that resource. It is so helpful. Me and my wife, we had 3 consultations before we ended up enrolling, because I've never had the chance to do it before. For the last 10 years, I was the guy that signed up at the last hour of the last day of open enrollments. I knew I got in trouble if I didn't, but I didn't really understand it. So I kept putting it off. And so instead, now we wanted to create an experience for business professionals. So you don't put it off, right? You have someone who will walk you through it. And then what you're going to find is that while we're going to maximize your subsidies and help you, in the event that you are not subsidized, you make over $55,000 a year and you're paying full blown for your own healthcare, it gets really expensive really fast. I think everybody knows it's ridiculous, right? Like healthcare costs feel very made up, and because they are. Hospitals generally upcharge things about 600%. And it's not a made up number. It's actually what hospitals upcharge. And the reason they do that is because they're hoping like, okay, the insurance company will come in way down here and we'll ask way up here and we'll get some money out of it. And it's this weird dance. And so what Clearwater's done instead is to say, look, we are going to offer what is fair, and we're going to settle up with the insurance companies. But we're also going to put as much robustness and just stuff into these plans as we can so that you have the best coverage possible. And because we're what's called a vertically insured insurance company, or excuse me, a vertically integrated insurance company, which really is just a fancy way to say we own the whole ecosystem, right? What you think of as an insurance company is usually like 16 companies per state. And they're all moving money and paying each other. And this person does claims, and this company does this company does this, and this one can only do for 3 states, and this one's down here. We own all of it, which means we don't have to pay all those people. We also don't work with brokers, with insurance brokers. Instead, we go directly to the company. And so what that means is that we just have way better margin. And what we've chosen to do is, instead of doing the normal insurance play, which is, okay, well then let's just charge as much as we possibly can to get away with, we've actually dropped our prices really dramatically to make sure that we offer and get as many people covered as possible. And so when you go with, if you are not subsidized, right, and we're looking at apples to apples coverage, major medical insurance through AREAA Health is going to run you about, it's going to save an average of $9,000 a year per per 1099. That means that you're running about 30 to 35% less expensive than what anything would cost on healthcare.gov. And so that's going to be a benefit you have by being part of the membership or part of the organization. And then we also have an insurance alternative product, which is called Health Share. So it's a cost sharing program. It works for us just like insurance. It's a different chassis, is the way we would explain it. It's a different way to provide healthcare. And what we've done with that is it gives us the ability to be a little more choosy on who goes on those plans, right? Like if you apply for insurance through Clearwater, you're covered. There's no underwriting. You're good. You're going to get covered because it's insurance. On Clearwater's side, which we call it Clear Shares, the name of the plans, we don't allow people over 65 on those specific plans. Smokers are an extra $50 a month. I'm sorry if you're a smoker, it's an extra $50 a month. But the reason we do that is because it allows us to drop the cost on a monthly premium about 65%, which is crazy. So for instance, I was a W-2 employee of my own company, but a W-2 employee before I joined Clearwater. I was paying about $2,300 a month for healthcare for me, my wife, and my two kids. And we had really good coverage. It was $2,300 a month. It's a lot. We had about a $10,000 deductible. When we moved over to Clearwater, even before I worked for them, I just moved my coverage there. It went from $2,300 a month to $780 a month. My deductible went from $10,000 to $3,500, and I had better coverage. And so I said, just me personally, I saved over $14,000 a year just on my premium. And that doesn't even include the deductible and everything else. And so the way that we've built this is to make sure that you have as many options as possible. And we kind of treat it like, and I think everyone usually knows this example, we treat it like Costco, right? Costco has Kirkland products. They're great. They're also about 30% less expensive. It's their stuff. You've never seen a Kirkland's commercial. It's come to Costco. We will help you. And if this is the right fit for you, great, we've got it. If it's something else, we can also help you there. And so what AREAA really wanted to set up is an environment where no matter who you are, no matter what part of life you're in, no matter what season you're in, if you pay for your own coverage, we will help you. And we have the ability to do so. Really, the two types of folks that we just can't do much for, if you're on TRICARE, can't really beat free healthcare. And if you are 100% covered by your spouse's plan, you should probably stay on the free healthcare plan, right? Outside of those two scenarios, if you come to Clearwater and you need coverage, we can provide you literally every resource that you would have available with a consultant to walk you through it. And so that's really what the experience is. That's what we wanted to put together for you guys. We wanted to make sure that it was a very, very seamless process. There wasn't a lot of complicated stuff. You're not trying to compare plans that, quite frankly, like, I'm in healthcare, I still couldn't walk you through healthcare.gov, right? Like the number of options and the stuff, and you got a copay, but it doesn't kick in until this deductible is paid. And then you got this co-insurance, and then you've got this other stuff. It's a mess. And so Clearwater we want to keep everything, maybe, I don't think it's overly simple, brutally simple. Like I want you to be able to look at a plan and immediately understand it. And that way you know how to use it. And then the last thing I haven't talked about is going to be really what we believe healthcare is going to be in the next decade. It's called care coordination. So when someone is on a Clearwater plan, what we're going to have the ability to help them do is act like cash pay. So for instance, while we have a PPO network in all 50 states, so even if your state doesn't offer PPO on healthcare.gov, you can still get a PPO network through Clearwater. Even if a doctor says, well, I don't take that network, it's the PHCS network, it's the largest one in the country. If they don't take it, or you want to have your acupuncturist become your primary, and I say that one because we did that last week. That was actually a very specific topic that came up, right? There are rules we got to follow and we got to do it right, but we have the ability to give a much more personal approach to your coverage because we know you, right? And so we have the ability to call. If you've had a doctor for 4 years and they suddenly change to a different network, whether you change or not, by the way, doctors can change networks too. They may not be able to take your insurance anymore. And so what we will do is call and say, hey, you've been working with Crystal for 4 years. She really wants to continue working with you. We know you changed network. If we just paid you in cash up front at what we would pay on the insurance side, will you see her anyway? And 99.9% of the time, the answer is yes, right? Like for instance, I go to a direct primary care. It's one of a concierge medicine. I pay $150 a month. I can go every day to say hi if I want to. They do all my stuff in-house. Well, that they don't take insurance, but they will take Clearwater because Clearwater is the same as cash pay whenever we work through care coordination. And so when in doubt, call in. The call to action right now, like to be as explicit as possible, go to the website. I recommend you book a call at the very minimum. Just get a quote, see what your options are, and then let us give you the ability. Like, we want to give you the ability to actually walk through, ask questions, ask what you may consider dumb questions. But I promise you, when it comes to healthcare, there are no dumb questions, because the entire industry is dumb, right? So every question's a dumb question. We all just need help. Like, we need help, by the way. Like, when things happen, we have people we call to say, hey, why? Like, we're dealing with Blue Cross, they're being weird. What do we do? And so we're all in this together. We all come from very entrepreneurial, very real estate related or auxiliary backgrounds. And so we built this, like, without exaggeration. The last thing I'll say, and this will probably put everything in perspective, when we built Clearwater, the ideal client avatar for us was a real estate agent that makes $60,000 a year. That is literally the avatar the company is built around. And so we want to make sure we're here to help you. You have every option available. Do not FSBO your healthcare. You have people that cost nothing that want to help you. Please book a call or get a quote and take advantage of what AREAA has put together for you, because they worked really hard to pre-negotiate this deal. And I want to make sure that everyone who needs it gets to take advantage of it. So, Crystal, that's the program kind of in a nutshell. Do we have any questions from anybody that you guys would like to do a little Q&A or anything I can help with?
Thank you, Jack. No, I haven't seen any questions come through. We did shoot out to everyone the link, and so hopefully that's where everyone is going. Jack, I remember when we were originally looking into Clearwater, we were given some stats. Do you remember the stat of what percentage of agents have health insurance? Or
yeah, it's just under 30%.
Yeah, it's really
pretty bad. And the market has not helped, right? Like, the current market hasn't helped. And so, the stats that we usually remind people of is that 65% of bankruptcies, they list healthcare or medical costs as the number one reason. And this is the thing that just makes me mad, right? If I had hair, it'd make my hair fall out, which is 90% of the people that list medical costs as the number one reason for their bankruptcy, 90% of those people had health insurance. And so it's just, it caps, or they didn't understand it, or it's too complicated, or it's a gotcha thing, or whatever it may be. And so, hey, Frank, the way you do it is you would go to that website, and you either book a call, get a quote, however you want to do it, and it'll guide you through to get scheduled. It goes to what is effectively like a calendar. So you'll choose a day and a time that works best for you, and you'll be able to talk to somebody. But yeah, it's very aggressive in the number of people that aren't insured. And we want to make sure we change that, because it's kind of, sometimes it's a lot like life insurance, to where it's not really for you all the time. Sometimes it's for your loved ones or everybody else. Like, the example we always use is we had an agent, he didn't believe in health insurance, which I kind of get, right? And he had never really had it. He was in his mid-40s, got married, and his wife said, look, I don't care how you feel about it. You got to get something, because you got to help us. But he's with one of our affiliates. And so he got a discount, and he was able to get what we call a catastrophic plan for $180 a month, which gives you, like if you get a sinus infection, you're covered. If you have crazy stuff, you're covered, right? And so he, after enrolling, literally 3 weeks later, got COVID, was in the ICU for 19 weeks, had over $3 million in medical bills, and he paid $1,000. And so so one of our big things, and this is really important to our CEO, which is we have no caps, which is very unusual for healthcare. And so, because when I look at it, if you told me, I'm like, oh, well, you don't have $3 million in medical debt, you only have $2.5 million because you had $500,000. I might as well be $15 million in debt, right? Like, it doesn't matter at that point. And so we wanted to make sure it wasn't capped. We priced everything very aggressively. We wanted to roll as much margin back in as we could, which is why every Clearwater plan has free mental health, free telehealth, free preventative. Like, we want you to go get your blood work, your annual, your physical, right? Like, deferred maintenance on the human body is expensive. We want you guys to catch it. Like, how many people do you know that you're like, man, if they just would have gone a year earlier, they would have caught this and they'd still be around? Like, we refuse to allow the financials to play into that decision. If you have someone who just doesn't go, then that's a different thing. But if it's literally free for them to go, like, like you will literally save people's lives by having them sign up for this. We want to make sure that people have access to what they need to take care of themselves and their families. So.
Yeah, we absolutely loved it. And so those stats were really what made the member services committee jump on board with Clearwater and understand that, you know, with obviously most of our members being agents and not knowing that there was so few of them covered, we were like, this is something we need to make happen. And obviously, yeah, like you called it, your maintenance items. There's a lot of things when we really start to dig into what their coverage fully covers. There's a lot of those, yeah, maintenance items that we were like, that's cool that all of that is already there, readily available, and all you got to do is get up and get to the doctor. So
that's right. You just got to go, or you don't have to go to the doctor.
Telehealth, you're right. Yeah,
it's free. Right? Like telehealth is big for us. I have 2 little boys. And so telehealth gets used a lot after hours because they do weird stuff. And it's just they're little wrecking balls, right? And so, and they have no self-preservation instincts. And so telehealth's amazing. It's dragging them in at some point. That's going to be really challenging, but having it readily available, and it means I don't have to go to the ER. That's a huge deal, right? If I have something that happens after 5 o'clock, you're either waiting or you're going to the ER. Unless you have telehealth built in, and that's 24 hours. So it makes a huge difference.
Absolutely. And so as member services, I think I made mention at the beginning, we did talk to AREAA members who are currently covered by Clearwater. And again, that was one of our ways to vet Clearwater. And they had nothing but phenomenal things to say. And so obviously that is another reason why it did get pushed all the way through. So you guys, yeah, definitely click on that link, set up a call with them, and if you have any questions, I'm sure we will drop everyone's contact into the chat afterwards. But Jack, we appreciate you. We appreciate everything that you did for AREAA Nationals to make this partnership happen, and I hope our members take advantage of the amazing benefits that you guys are offering.
Thank you, Crystal. I appreciate you guys having me.
Absolutely. Thanks, you guys. Have a great one. Bye.
Bye.